Good afternoon. Welcome to
Good
the Scope at
afternoon.
Lunch, a special edition of the Scope podcast. My name is Summer Overshawn, and I'm your surprise host for today's webinar, filling in for Paige Heitman. We're going to touch on a couple of housekeeping items today before we get started. First, this Zoom session will be recorded. We'd like to know who everyone is, so please ensure your name is accurate. If you need help with this, please reach out to us using the chat box feature. I'll be moderating this session with my Phelps Health marketing colleague, Hillary McCash. So one of us will be sure to help you if you need it. Also, we would love to see everyone's faces. It makes for a much more fun and interactive session. If you feel comfortable doing so, please turn on your video now. Please note that each of you are currently muted. If you have a question that pertains to the topic being discussed, please add the question to the chat box and we'll try to get that question answered. You can also add comments in the chat box. One thing to note about the chat box is that you can send questions and comments to the whole group or just one person. We'd encourage everyone to participate in the discussion. However, you are more than welcome just to send a private question or comment if you feel more comfortable doing that. We also want to encourage everyone to utilize the reactions that Zoom offers during this discussion today. You can use a hand clap, a thumbs up, thumbs down, etc., to let us know if you like, love, disagree, or agree with whatever we're discussing. Reactions are in two places, one either at the top or bottom of your screen, and one you will see when you display the participant list. We will be conducting a few polls throughout this Zoom meeting, so you'll get a chance to interact then if you choose. And of course, remember the chat feature. Some of you may be using a mobile device, while some of you may be using a laptop or computer. If you find that your features are not the same, we just ask that you participate with us however you can. If you have issues with your sound, the Zoom meeting, or other features, please use the chat box and one of our moderators will be happy to assist. So with all of that said, our guest today is Dr. Sylvester Youlo, who is an orthopedic surgeon and sports medicine physician at Phelps Health. Good afternoon, Dr. Youlo.
No, thank you for having me today.
We're so excited. This is a really great topic, and there's a lot of people that this is affected. So Dr. Youlo, how common are knee injuries in athletes, especially when they're dealing with contact sports?
Well, to be honest, knee injury is the second most common injury that is experienced amongst all athletes. The first is usually ankle sprains, but the next one is knee injuries. Now, when you talk about knee injuries, it's not a spectrum of severity. So from nothing significant, which for most part, most people don't see a doctor for, to something that can be very significant that can impact the athlete's career. So the second most common injuries that athletes experience, especially in contact sport, is knee injury.
Wow, that's very common. I mean, I know that most people have known someone that has had a knee injury or been affected by some sort of knee injury that's really affected them throughout their life. I remember when I was in high school, one of my best friends did something terrible to her knee during a basketball game, and she was never the same. She still has problems with it to date.
Yeah, such injuries are usually significant injuries. Most of the injuries, the majority of injuries usually do not require a lot of help. In fact, people have injuries that they never see doctors for, but when there are certain signs, and we will discuss this today, but there are certain things you should watch out for when you have an injury that sometimes it is very important to see a doctor for.
So what are the most common knee injuries athletes may experience? When we talk about having a knee injury, what are the types that you typically see in your practice?
So let's just back up a little bit. The most important thing, I think, where to start from if you discuss knee injuries is to understand what is the knee really. Mm-hmm. Because if you know what the knee is, and then you can go from there and discuss the injuries and how it may affect you in the future. Now, there have been thousands and thousands of books and book chapters that have been written about the knee. So I do not pretend I can educate our audience about the knee completely today, but the simplistic form of the knee is what I'm going to describe right now. So if you think about the knee, there are three major parts the knee has. They are the muscles and tendons around the knee. They are the ligaments, and then they are what we call the cartilage on the inside of the knee. The knee is made up mostly of the shin bone and the thigh bone, the femur and the tibia. And at the end of those two bones, at the end of those bones coming together, it is covered with a layer of tissue. And so the end of the femur has a layer of tissue that's called cartilage. It's a smooth layer that everybody needs to have a normal functional knee. The same layer is at the end of the shin bone. Those layers, you don't want to lose them. Between those two layers, there is a small tissue that sits both on the inside of the knee, what we call the medial side of the knee towards the other knee, and the outside, the lateral side of the knee. And that small tissue is called the meniscus. Okay, so you have the end of the bone that is covered with the cartilage, and then there's meniscus between those layers. And then you have four major ligaments around the knee. There are two on the outside of the knee. Towards the outside, it's called the LCL, lateral collateral ligament. There's one towards the inside of the knee, facing the other part of your knee. The other knee is called the MCL. Then smack down in the middle of the knee, deep on the inside, there are two other ligaments, one that is called the ACL, and there's one called the PCL. So all those things come together to form the knee. And depending on the injury that you have on your knee, it can be one of those things.
Okay. That's a lot of information, and it's hard to know. So which athletes are most susceptible to getting these types of knee injuries? Are there certain types more prone to it?
That's correct. So the most common injury that people experience is what we call contusion. Pretty much it's a knee bruise. So if you have a knee bruise, usually that should go away within a couple of days or maybe a day or two, just taking rest. The injury that contact athletes have that can be a problem is having a ligament injury or tearing a meniscus. So I told you about a meniscus as a tissue that sits in the middle of the knee. If your meniscus is torn or one of your ligaments are torn, that knee will be a problem for you for a long time unless that is taken care of.
So are there certain sports or types of athletes that are more prone to getting a knee injury? Or is it football, or are there certain ones that you see repetitively in your practice? Yes.
So the worst of the injuries that can happen, in my opinion, is an injury that makes the knee unstable. So which means I got an injury, but every time I try to walk and try to run, my knee tends to give out. That is an instability problem, and that can lead to long-term problem. Mm-hmm. And one of the major things athletes can have that can lead to instability is having an ACL torn. That is a ligament on the inside of the knee. That ligament is responsible for stopping the knee when you're running and you stop, that ligament stops the knee from going. If you don't have that ligament, your knee tends to give out. People that play basketball, cutting, jumping sports, such as basketball and soccer, are very prone to having an ACL injury. Yeah.
It's funny you say that. The people that I know that have had injuries like that, it was basketball and softball or stuff like that. So that sounds exactly the way that I've understood it. So Dr. Youlo, how do you diagnose knee problems? When someone comes into your office, how do you go about doing that?
So the first thing I do to my patient is you need a story, you need a history. What happened? How did it happen? So let's pretend somebody that had an ACL injury, the kind of story they would tell me. Hey, doc, I was playing basketball. Nobody touched me. I jumped, and when I landed, my knee gave out. Mm-hmm. That is a terrible story. So when I hear such a story, the first thing that come up, you might have an ACL injury. The second thing I ask my patients, when you had a knee injury, was the knee swollen immediately, or maybe a couple of hours later? If you have a knee injury and the knee swells, that is a problem, because the swelling that you get from a knee injury. Now we are talking about healthy athletes that are playing. If you have a knee injury that swells, that swelling in the knee is usually blood. And if you have an injury and there is blood in your knee, there is something that is torn that is bleeding. And so if you have an injury that you described to me, I had an injury, this is how it happened, and the knee swells, that is worrisome. Mm-hmm.
So when someone comes in or if somebody's in a certain sport, I mean, can they determine whether they're at risk? Just if they're in these certain sports, let me back up. I'm kind of stumbling over my words here because I'm thinking ahead of myself. But you were talking about any sort of basketball or anything where you're jumping up and down repetitively. So are you just going to be more at risk if you participate in those sports, or is there like some sort of genetic disposition you may have? Or is it all about the same for anybody that participates in these certain types of activities?
Well, the genetics is difficult to say. Well, there are certain genetics problems which are not that common that can lead to joints injuries. That is a topic for another day. But there are certain there, as far as we know, let's talk about the ACL. We do know there are a ton of studies that have shown that ACL injuries are more common in women than men. So playing the same sport, men and women, the women have more ACL injury compared to men. Certain sports, yes, do predispose people to having ACL injury. Basketball and soccer are two common ones. So the sports that involve cutting, running, stopping, cutting, and jumping, those sports are very likely to lead to ACL injuries. So if you play soccer and you're a woman, there's a higher chance that you may have an ACL injury compared to somebody who doesn't play that sport.
That's really interesting. I hadn't thought about it being split out into demographics, men versus women, depending on that, women. So that's really interesting. So besides what you were talking about before about the swelling and all of that, how would someone know if their knee pain is something serious that they would need to come in and talk to you about?
So you just mentioned the first thing. So if you have a knee injury and the knee is swollen, you need somebody to look at it. You need a doctor to look at it. You need a clinician to look at it. So if it is not a doctor, if it is your family, your PA, but you need a clinician to look at it. So swollen knee after an injury is bad. If you have an injury and the knee is not swollen, so swollen knee is a sign, but sometimes you can injure a knee without swelling that you can see. The swelling might not be that much. So you injure your knee and it doesn't swell, but it is hurting you, and putting your weight on the knee hurts. For a few days, you need to see somebody, because you may have told something in your knee that is not making the knee to swell. There are ligaments on the outside of the knee that is not smacked down in the inside of the knee that you can tear without having swelling of the knee, because the ligaments are not on the inside of the knee. Something has to be on the inside of the knee for the knee to swell. So if you have a knee injury, let's pretend and the knee hurts when you touch it and it doesn't want to stop, you need to see somebody, because you may have a ligament that is torn on the outside. If you have a knee injury and the knee feels unstable, my knee doesn't hurt much, but when I walk or when I try to run, the knee tends to give out. That is something you need somebody to see.
Very good. So thinking about some athletes, and especially younger athletes, typically I've seen kids in high school when they're playing and maybe they hurt themselves during a game, but they want to go back in and finish the game because they don't want to let their teammates down or whatever the case may be. Should an athlete continue to play or finish the game if they have hurt their knee? And why do they, what should they do instead of playing if it's not recommended? And how do you know if it's that bad to not go back and play?
Right. So that question there is actually a question I've played most small communities. Okay. So most communities that have a lot of clinicians available, usually we try to have somebody on the sidelines who can evaluate these kids.
Mm-hmm.
Most communities. So is there somebody on the sideline who can clinically evaluate the patient? They can do so and make the decision whether they can go in. Because remember, there are different levels of injuries you can have. You can have a bruise and it may hurt. But how do you know it's a bruise? It is difficult for somebody who is not a clinician to know that. So having somebody on the sideline to help the kids would be helpful. And that's one of the reasons I came to this community. Here in the community, there are a lot of clinicians. It's not a lot of people that go on the sidelines. The few schools that have people here that go on the sidelines, I've given them my contact information. So if you don't have somebody on the sideline, that is a tough decision. But if there's somebody on the sideline, even if I'm not in one, but there is another clinician, if they evaluate the patient and they deem that it's possible for them to go back, then that is okay.
Yeah, that's an excellent point. I hadn't really thought about that until you said that, that it would be nice to have somebody there who could quickly assess it and tell whether they needed to go seek medical treatment or if they were okay to go ahead throughout the game.
Right. Yeah, I know when I was growing up, and I grew up in a small town myself in West Africa, we didn't have much doctors, let alone anybody to help you. So when you're playing sport and you hurt your knee, it was pretty much rub dirt on it and go back. And we did that, but we try to avoid that kind of stuff in bigger communities.
Mm-hmm.
A small community like Rolla and the surrounding area, including Waynesville and Salem, these schools, they have the opportunity now because we are here. I've told some of the coaches that I've met, keep a number. If there's a kid that gets hurt, There's Zoom, there is FaceTime. I can help you over the phone. Call me, call somebody, and just don't make any decisions by sending the kid back if you're not sure that they can go back.
Right. And what a great asset that is to have you available to assess those things. That's wonderful that we have that here in our community. So Dr. Youlo, talking about knee pain again, and something else that you typically see is someone will have an injury, but they don't want to seek treatment because they keep thinking it's going to go away on its own. Is that going to happen?
Is that going to happen?
The knee pain, will it go away on its own? Like them waiting around for it to go away on its own, is that ever going to happen? Or should they just go ahead and see someone at the beginning?
Well, the question is, first thing is, one is, how bad is knee pain? Two, how long has it been going on? So if you place your play, and remember the mechanism of injury is important. Let's pretend there's a kid who's in a football game, okay, and he's a running back. He's running and somebody hit his knee. He fell, the knee hurts a little, or the knee hurts a lot. It didn't get swollen. He got out of the game, and the next week, Friday, the knee doesn't hurt again. Well, go play, right? Mm-hmm. Even if they don't have somebody evaluating them, the knee doesn't hurt again. The knee never swell. Go play. There's a kid that hurt his knee last season and still can't run because he feels the knee is unstable. That knee needs to be seen. Somebody needs to evaluate it.
Okay. That's good advice. So what are the symptoms of a torn ligament in the knee? I know you were talking about the different tissues earlier, but what is someone going to experience if they experience a major injury when they're playing a game?
All right. So remember how I described what we think the knee is, the anatomy of the knee. Depending on what is injured in the knee, your symptoms can kind of tell what's going on. If you have a ligament that is responsible for stabilizing the knee will be unstable. So if you have an ACL injury and you jump and you land, your knee will tend to give out, or at least the knee will want to give out. If you tore a meniscus on the inside of the knee, but you didn't have a ligament injury and you play, you'll always have a sensation that there's something stuck in the knee at some point. You'll feel that. And there are two menisci. There are one at the inside, towards the inside of the knee, and there are one towards the outside of your knee. Wherever that meniscus is torn is usually where your pain will be. If you have a ligament that is not on the inside of the knee, there is an LCL and an MCL. Those ligaments tend to also help with stability. But if you have one of those, your pain will be specifically to where that ligament used to attack. That's where the pain will be.
So is it sharp and very intense, or can it just vary depending on the individual? Right.
So most pain issues, it's a pain. So instability is technically not a pain issue. Okay. So the instability means, I try to, when I land, my knee kind of feel like it won't hold up. In most cases, people don't have pain. Not always. In most cases, it's not a pain problem. I can't trust my knee to do what I want to do. So that's the problem. You need to see somebody. Okay. In the case of a pain issue, yes, it's usually a sharp pain depending on what kind of ligament you have. It is those ligaments that are on the outside of your knee. Most of the time it's sharp pain, sometimes instability. When it's a meniscus, it is both pain and a sense of something. I feel like something is cut on it. I want to pop my knee, but I wouldn't pop. It's like something is stuck on the inside of the knee. That's what the patients will say.
That's interesting. I guess I've always just assumed it was very intense pain, and that was pretty much the only symptom you would have. So that's really good information to know. So if an athlete tears a ligament in the knee, how do you determine whether or not they're a good candidate for surgery?
It depends on the ligament, and it depends on the severity of the injury to that ligament. So remember, there are four major ligaments on the knee. There is the MCL, the LCL on the outside, and then on the inside, there are the PCL and the ACL. Let's start on the outside. Most people that have MCL injuries are not treated surgically. They tend to heal on their own, isolated MCL injury. Same thing with LCL. LCL injuries are not that common, but isolated LCL injuries also are treated non-surgically. There are three levels of injuries you can have on the MCL, and we grade them, grade 1, 2, and 3. When you get to a grade 1, grade 3 is a worse kind of injury, and sometimes those are the ones that tend to not heal. But most of the ligament on the outside of the knee, if you hurt them and you're having pain, we do bracing, and most of them tend to heal if you are compliant with wearing your brace, and we take the kids out of sports. ACL is the one that has become a problem for years. We haven't found out a way to let an ACL heal by itself. So if you tore your ACL in this day and age, if you tore your ACL and you are active, even if you're not an athlete and you're active, you need an ACL reconstruction.
So what does recovery and rehab look like if you do have to have a knee surgery? Is it a long period of time, or does it again just depend on the individual and how quickly they can recover?
It's not an individual, it depends on what is treated.
Mm-hmm.
So if you have a ligament reconstruction, most of them, you need about 3 to 6 months to return to sports. If you have an ACL reconstruction, to be able to return to sports is about 9 months to a year for most clinicians. So if you have a ligament reconstruction, it can take you that long.
So once you have surgery and you go through the rehabilitation, do most people get back to the way they were before the injury happened, or is it just, so will they always still have a little bit of a problem?
We've done a lot of studies to figure that out. And what we found, it depends on the level of sport that person is playing. So for somebody who's playing recreational sports, most of them will be able to go back to those sports. For somebody playing the NFL, the numbers are less so for them returning back to the level of playing.
So I am going to go ahead and skip the next polling question because we've had technical difficulties today. That's what we get for letting Paige go out of town. So you will all forgive me, please, if I just pass on by. So you mentioned a brace, Dr. Youlo, earlier. Can you supplement knee pain with a brace, or should you just seek physical therapy or medical treatment? I've heard things about the brace. I've heard pros for it and cons against it, and I'm not really sure what is recommended.
So we're talking about bracing for after a knee injury, correct?
Yes, but even before, like say you twist your ankle or twist it somehow, can you put one on to make it, to stabilize it better, but to make sure you aren't going to injure it further? Or does it even help?
You can do that. Now, remember, so the only studies we've seen that say bracing can help things with, so the purpose of a brace is to stabilize the knee. That's what people tend to wear them for, or at least should wear them for.
Mm-hmm.
So if you have a ligament injury that requires the knee to be stabilized, the brace can help. What we found is that the brace both help the knee to feel a little stable, but it also give you a feedback to let you know something's wrong with my knee. I should go a little easier. So most bracing doesn't hurt to wear them. Now, depending on the injury you have, a brace may not be the definitive treatment that you need, but most bracing can help the knee to feel a little better.
Good. So what about cortisone injections? Are they helpful for knee pain at all?
Well, knee pain generally, yes, cortisone injection may help. But what kind of pain are you treating? If it is a knee that is hurting and there is no injury to the knee, and the knee is just inflamed, it's something called synovitis, where the knee is just inflamed, yes, a cortisone injection may help. But once again, you can't just ask for a cortisone injection. I think what shouldn't be lost in here is there has to be somebody who makes sure that your knee, you don't have an ACL injury and knee is stable and you get a cortisone injection. That is not going to work. Mm-hmm. If you have a knee that is just inflamed and it's hurting you, and a clinician decide that's what you need, yes, a cortisone injection may help. Yes.
So what about ice or heat? I've heard back and forth on that as well. Some people say to ice it, some people say to heat works better. What's your recommendation?
For acute injuries, ice is better.
Okay.
But somebody who does not have an injury, that just have knee pain, which is a different topic from this topic, the old lady or the old gentleman who has knee arthritis that went on a vacation, did a lot of walking, and is having knee pain, yes, they can use either one that feels comfortable. Mm-hmm. There's not one that is better than other for such a pain. For acute injuries, icing is better than heating it.
Okay. And is that because of the swelling?
That's correct.
So what over-the-counter medications can you take for knee pain? Is there anything you could take like a Motrin, or what do you recommend there?
So for knee pain from an injury that is less severe, like a contusion, ibuprofen, Motrin, Aleve, one of those things can help you. There are some people that can tolerate those medications. We'll call them NSAIDs. Then Tylenol is okay.
So if an athlete has to have surgery, because that is a huge decision, what are the benefits, or what would you say to your patients that would be good candidates for a knee surgery? Why would you recommend for them to go ahead and do it?
Depending on the injury, you can cause long-term problems to your knee. If you're an athlete, just pretend a high school athlete who was in a game, hurt their knee, and the knee continued to hurt. They saw me, and I got testing, and it proved they have a meniscal tear. So you tore your meniscus, and the decision is, should we have surgery or not? That person needs surgery. Well, why? Because the meniscus served a purpose in your knee. The problem we are trying to prevent from your knee having is, one, well, we want to stop the heat, the pain, so you can get back to your sport. But the second thing is, if you lose your meniscus in a normal knee, long term, which means long term, which is actually a short term for the individual, you will develop knee arthritis. So in a young active patient that have a torn meniscus, you need to keep your meniscus. You don't want to lose it. Mm-hmm. So you need to have that repair. Well, suppose I don't want to repair my meniscus and I want to wait for 5 years. Well, the meniscus tear does not stay repairable for that amount of time. So if you tear your meniscus now and you're a tough guy and you can handle the pain and you want to wait for 5 years, that meniscus in 5 years will not be repairable. It will be torn into shreds. And so if you decide to have surgery at that time, you will lose that meniscus, because that's all we do. We take it out because it can be repaired. If you don't have the meniscus in a normal knee, you put yourself at risk of getting knee arthritis. Now, one of the most common surgeries we perform around the world is partial meniscectomy, which is we take part of the meniscus. But that surgery is in people that we are not discussing today. In athletes, the most common thing we want to do is repair it. The only time we take out part of your meniscus if either your knee is too gone or the meniscus is irreparable.
So there's a window of opportunity for you to perform the surgery, which is something I didn't know as well.
Yes, you need, there are certain injuries that you need to perform surgery. And one of them is a torn meniscus and an ACL in an active, healthy person. Because if you tear your ACL and you don't repair it, guess what? You will tear your meniscus. Everybody will. If you tear your meniscus and you don't have a meniscus in your knee, you will develop knee arthritis at an early age. So torn meniscus is a bad deal. Mm-hmm. Or torn meniscus that is not there, or is not functional, is bad for your knee.
So once someone has a knee surgery, will there be follow-up surgeries for them at any point, or is it kind of a one and done deal?
So you can have, if you are human, you can always have a repeat injury. Mm-hmm. If you are human, you're active, you can always have another surgery for re-injuring the knee. Now, if you have knee surgery and the problem you have was repaired and healed, you can get back to your normal activities and shouldn't be worried about having a follow-up surgery. There are certain surgical procedures that may need a follow-up surgery that is not done in one stage. That is a different story, but you don't need a second surgery because you have one. You have the surgery to repair the problem, and if that problem is solved, you should be good to go.
Very good. So how successful are knee surgeries then along that line?
Success, knee surgeries are very successful. Again, there are different levels of surgeries, but most knee surgeries are very successful. We talked about ACL reconstruction and whether you can go back and play. We've known for a long time that people that play very competitive, high-level sports, such as basketball or football in NFL, it's not everybody that go back. But every day I've had a bunch of kids that have had ACL reconstruction. I went back and played sport throughout high school and even went to college and played.
It's really great, really great. So are there risks associated with knee surgeries? I know with any sort of surgery, there's always some sort of risk involved, right? But are there common risks associated that people would need to know about ahead of time?
So specifically to the surgery, So talk about ACL. There's a risk of re-tearing your ACL if you had ACL reconstruction. The fact that you had an ACL tear before put you at risk anyway for tearing your ACL again. There is a risk of having an ACL done and the knee still feels unstable. And one of the things we found is, which is another topic, is who did the ACL and how did they do it? There is a debate right now about whether to do the ACL like it was before the person had an injury or to put it to a different spot. There is a debate. There are two camps and the debate is not that clear. I happen to believe that you fix something back to where it came from. You shouldn't put it somewhere else. But that's a different story. So yes, there are risks associated with the surgery, but the surgery, the risk is specific to that surgery.
So what type of physical therapy can an athlete expect after surgery? I'm assuming that some sort of rehabilitation is going to be required.
That's correct. I send all my athletes to therapy. And one thing we did not spend time talking about is I told you the knee is made of the ligament, the cartilage, and then muscles around the knee. The muscles around the knee is actually the brace that the knee needs. So I'm not a big fan of having patients wearing braces for a long time. I have you wear brace for short term until we can get your knee to work like it should. And what we find out is that the muscles around the knee serve as a knee brace. Internal, that's your own brace that you have. And so when patients have surgery, the first thing you'll find is the strength of the knee decreases significantly after surgery. And I use therapy to build up the strength of the knee. The other thing we find is sometimes when you have surgery, the knee hurts, so you don't move it. And there is always a potential to lose range of motion. If your knee can move like normal, it doesn't feel good. And so therapy helps with that too.
Is it true that you want people to try to move as quickly as possible after surgery?
Depends, yes. For knee surgery, almost all my knee surgery, I want you to move as soon as you can. And when you see me around the operating room and I'm talking to my patients that are having knee surgeries, I tell them, when you get home, today you will be tired after your surgery. Most knee surgeries, by the way, go home the same day. And I tell them, when you go home today, you will be tired. You can rest and don't do much. But beginning tomorrow, I want you to move that knee. And depending on the surgery, there's a specific amount of movement you need that I recommend, and there's steady movement I don't recommend, and I'll spell those out.
That's really amazing that you can go home the same day as having the surgery. I know we talked a little bit about athletes returning to their sport after a knee surgery, so I'm going to go ahead and skip on through that. So Dr. Youlo, what can athletes do to keep their knees healthy during the course of their athletic career? I know sometimes we don't think a lot about small things like that or different parts of our body, but what do you recommend people do to make sure they're staying as healthy and careful as possible?
So the most important thing I tell all my athletes is do not become deconditioned. And what you'll find, especially in high school sports, mostly not in professional sports, but in sports that are not professional, where people are not paid to play, during the off season, they become us. That I don't play any sport. You can't become me, because I don't do anything. I just walk around and perform surgeries and read and do stuff. If you're an athlete, you have to always be an athlete as long as you want to become. And so during the off season, you can't take the off season off. It's during your off season is when you prepare for the next season. So you have to be conditioned. If your knee is not conditioned and you go back to play, your chance of having an injury is higher. So keeping your knee conditioned is very important to prevent injuries.
So along what you were just saying, it just made me think of people sometimes that start out doing some sort of exercising or a program all at once and too quickly. It made me think that maybe they shouldn't do that. Are they more prone to having an injury because they aren't building that up and keeping it conditioned, as you said? Like I'm thinking of people who start some sort of program, maybe they haven't done anything, but then they go all in. Is that injuries because of that?
Yeah, you shouldn't do that. You shouldn't go all in. So if you haven't, so if you're not an athlete and you're one of us and you want to get back to, you used to play sport, but you stop and you want to get back with your buddies to play sports, your best bet is to go slowly. So the first thing I tell my patients is, if you wanted to start a running program, which is a sport, but I haven't run in 10 years, but I want to start. Don't start running right away. I'll have you get on a bike, stationary bike, and use that for a couple of weeks and see how it feels. And then start using an elliptical in between the bike and elliptical. As you get stronger, maybe use a style climber and see how your knees feel. As you start to feel better, then start jogging. If jogging doesn't bother you, before you start running. So you have to build up to it. You can't just start from 0 to 90. That is how people get injuries.
So we have a couple of minutes left to answer 2 or 3 questions that came in throughout this session before we wrap up. Dr. Youlo, what should athletes take steroids to help with knee pain, or is that something that's prescribed, or what are your thoughts on that?
Well, so when we talk athletes and we use the word steroids, they mean different kinds of things.
Mhm.
So there is something we call corticosteroid. We give people all the time, not for a likely reason, but for pain, for inflammation. You can't just take that because your knee hurt. Somebody needs to make a diagnosis of why your knee hurt. Now, there are steroids that are banned from most sports. Those are not corticosteroids. Those are illegal drugs that people take to gain an advantage because they help to build your muscle. That you shouldn't encourage any of your athletes to take them because they can lead to a lot of major medical problems, including death. So I wouldn't take those. But for just a corticosteroid, that is, you can take it, but you need somebody to check your injury before you start taking such.
So what happens if an athlete elects not to pursue surgery? Do you find that sometimes people are reluctant to do it, so they tell you they just don't want to? I mean, what happens then? Are they going to progress and get worse?
So I'll give you an example. I saw a very nice lady, and actually did her surgery a few weeks back. She injured her knee when she was in high school, and she saw a doctor who told her you need an ACL reconstruction, but she wasn't ready. She didn't want to have surgery. Her parents were not ready. So at 17, she left the injury, and until recently, she has very difficult time performing basic functions without severe pain and the knee being unstable. So she couldn't take it anymore. So she came to see me. She told me I tore my ACL years ago, and they told me I needed surgery, and I didn't do it. But my knee doesn't work anymore. I'm struggling.
Mhm.
And so I got another MRI. It's a test that we use to check the knee. And what we found on the MRI was she's already developed enough arthritis in her knee that her knee looked like she almost needed an artificial knee. But she's young. She's in her 30s. So we took her to surgery to reconstruct her ACL. And when I went in there, she has severe arthritis on the inside of the knee. And that's what happens. If you have a specific injury, like ACL or your torn meniscus, and you put it off, you will lose your knee in an early age. And the only treatment we have that may work for you, if you have a knee that becomes severely arthritic, is treatment that is reserved for old patients. For 60 years old, 90 years old, 80 years old, at 30-something, you do not want your knee to look like a knee of a 60 years old, because the treatment for a 60-year-old does not work for young people.
Yeah. Another question that came through is asking, is glucosamine effective in preventing injury?
There's no study that says such.
Okay. Well, thank you so much to everyone for tuning into the Scope at Lunch. Again, a huge thank you to our guest, Dr. Youlo, for joining us today. We really appreciate all of your insight, and you've really been able to help us learn a lot more about this common injury. As a reminder, this show has been recorded and we will email it to all the participants. It can also be rewatched on our Facebook page and shared with family and friends who may have missed the show. If you like the show and would like to know more, please check out other episodes of The Scope on YouTube or visit phelpshealth.org. Everyone have a great rest of your day. Thank you.
Thank you.